Greetings and welcome to another edition of Between the Lines. I am your host, Karanja Jackson. Today we discuss matters health. Nakuru County continues to witness a rise in numbers of the COVID-19. And in studio today we have Bona Chief Officer who will be helping us discuss what this means and what exactly the county is doing in regards to this. So in studio today we have Chief Officer Health Services, Dr. Samwel King'ori. Karibu sana Bona Daktari.
Yes, good afternoon.
And karibu, and thank you for finding time to come here.
Okay, thank you.
So, Bona Daktari, we start with a huge matter at hand, and the latest release by the county government indicates that in the last 2 weeks, Nakuru County has actually recorded 273 COVID-19 cases. Bona Daktari, what is causing these rise in numbers in our county?
Yes, thank you, Bona Jackson. I want to say that there is no need to worry. These are not increases in numbers. What we have done is that we have increased the testing in Nakuru County. We used to sample or to test 1,000 samples per week. But now we are doing testing for about 2,500. We have increased testing because of one, we want to know our population. How is our community? How are they? It's like, for example, if you want to do a sample for the fish in Lake Victoria, if you use what we call a hook, you'll just be getting one fish at a time. But when you use a net, and you stretch your net wider, you'll be able to get all the fish that you want, and in that way you're able to know the type of the fish in the lake, and you're able to know the situation.
Be that as it may,
yes.
But 273 in 2 weeks.
Yes.
This is quite an alarming number, yes, when you look at it, especially in the
yes,
national context.
Yes, when you look at just in terms of numbers,
yes,
that is you might think that there are too many, but when you go scientifically, that is what we are talking about. For example, Nakuru County, yesterday, we took about 450 samples to our laboratories, which contributed to about those cases, the number of cases. But if you look at it from a national point of view, the whole country, that is 46 counties, no, 47 counties, they contributed about 4,200 and something 50 samples. But Nakuru County alone, they contributed about 10.5% of the total samples. Meaning, we are doing more samples, we are testing so many people than the other counties. And another thing that I also want to let you know is that the population, our population proportionality in Kenya, Nakuru is about 4% of the total population. But we are taking more than 10.5% samples, meaning we are doing more samples than any other county.
Okay, so we are taking more samples.
More samples.
What necessitated the need for us to do more samples?
Okay, yes. From public health point of view, it is always advisable that whenever you want to deal with any problem within the community, when it comes to health issue, you need to do a random sample. And when you do a random sample, you need to have a certain number or a certain population that you need to sample, a sample size, so that you are able to generalize the results that you get from the population. Like now, for example, in Nakuru County, we have decided that can we test the whole county, all the 11 sub-counties. Before, we used to just wait for people to come to our hospital, and those people who come to the hospital, we test them. Or the people that they are a primary contact of a confirmed case. That is the way we used to do. But now what we have been able to do is to go out there to the community, test more people, so that we are able to know what is the level of community transmission of this disease within the population. And let me tell you, the figure that we are getting, the results that we are getting, is that we are doing the right thing. If you go to our statistics, it will show you that the positivity rate the positivity rate has come down up to less than 10. It started about 8 point something percent. But before, we used to have more than 27%, meaning there are very few people who are getting positive, and that's what the number that we are getting is because of the sample that we are doing. The other issue is that we want to gauge our interventions really working. And that's why you have to go out there. Like, for example, you have gone to Subukia, you have gone to Moro, Logai, Joro, Nakuru East, Nakuru West, and the other part of the county, so that we want to know what is happening within the population. And you know that when it comes to the COVID-19, 90% of the people, they usually have what we call asthmatic cases. It's only 10 that will show signs and symptoms, and it's only 5% that will go to the severe form of the disease. And therefore, if we wait to the hospital, only 5% will come to our hospital. And we shall be cheating ourselves that Nakuru is safe, well, things are not in the right way. And that's why we are doing that the way we have done it. Mm-hmm. So far, we have been able to collect more than 10,000 samples within the whole county. And that is the number that we are getting. Yes.
Speaking of testing,
yes.
We saw this happen in Mombasa and several counties,
yes,
where people were actually running away.
Mm-hmm.
When now the county government was going to the people and asking them that, come, we want to do mass testing. Mm-hmm. What have you done as a county to have people actually come on board voluntarily?
Yes, I want to tell you that what we have been able to do is that we have been going to the community. We are using our community health volunteers. We are using our community health extension workers, who are public health officers, nurses, name them. And what we have been able to do is that we have gone to the community, educating them about the disease, sensitizing them, so that when it comes to the awareness in Nakuru, people are very much aware about the corona. And let me tell you, every day I'm getting so many calls. People want to test themselves. They want to know their status. Like today, there are more than 10 people who have called me, telling me, I want to know my status so that nijipage vizuri. And that is a good show. Let me tell you, when you go to the community, people are coming in large numbers. They want to know their status. And that's how we are able to get these numbers. Mm-hmm. The other issue is that because of this sensitization within the community, and this conversation within the community, that's why people are coming in large numbers. People are not fearing like the way they used to fear. Yeah. And I'm happy that I can tell you that nowadays people are not fearing corona the way they used to do the first day. Mm-hmm. Because what the people thought is that once I am suspected that I have corona, I will be quarantined at a certain place or isolated. But nowadays what we are doing, we are isolating people at household level, those who have the asthmatic form of COVID-19. Those who are primary contacts, we are also isolating we are also quarantining them at home. So there is no stigma the way it used to be. Because before, once somebody tests positive, we used to go with the Land Cruiser, with the siren.
Yes, with siren.
And yes,
saw this.
And also with the police to get you and take you to a place. And that way we have stopped. The other way we are doing the other way around. Yes.
And now let us talk about, we will be looking at how fear is playing part in the fight against COVID, in that people have stopped fearing. But we'll come to that. Let us go back to testing.
Yes.
You have mentioned that several people are actually calling you and are saying that they want to get tested.
Yes.
Let's take, for example, Jackson wants to get tested today. Am I supposed to pay anything? Let's start there, because that is normally the big question.
Jackson, you are not supposed to pay anything. What you need to do, just walk in our testing center, that is PGH, Lagalaga, Naivasha, or call our department at the sub-county level. They are also doing the testing. And then somebody will come and collect the sample, and you take it, you get the results. At no cost.
How soon? How soon can I get the results?
You are getting results depending with the time and the number of the samples that you have collected. You are able to get within 24 hours. The maximum is 3 days because of the number. Like, for example, the recent one, we took today morning to Kisumu, and by tomorrow, people will get the results. Yes.
And now that you've actually mentioned this was also another question.
Yes.
About the testing.
Yes.
And the labs to look at this.
Yes.
In a previous discussion we had with Bwana Waziri, he
Yes.
had mentioned that the county was actually making progress
Yes.
in getting its own lab. How far are we in regards to
Okay,
this?
yeah, about the lab, already we have done what we call assessment. It has been done by the AMREF Health Africa. They have done the assessment. They have seen that we have the infrastructure in place, and we have the right human resource. What we are waiting is that when it comes to the testing of COVID, it's a national government function. We are waiting now the government to bring the machine down to the county. But we have everything that is required. Yes.
Okay. Now, let us now talk about fear, and you have mentioned it previously.
Yes.
People have stopped fearing
Yes.
COVID-19.
Yes.
We go back to March when people had actually closed shops,
Yes. Yes.
closed offices, and gone back home.
Yes.
Now, we are witnessing, and you have mentioned that people have stopped fearing
Yes.
COVID-19. Do you think that this has actually played a part in
Okay.
people now stopping?
This issue of fear, let me tell you, people have become fatigued because of the issue of the COVID. People have been wearing this mask. People have been talking about the COVID-19, and they have talked about it for more than 6 months, and people have become fatigued, and this fatigue is very dangerous, because what we realized during the 1918 spine flu is that during the first wave, very few people died. That is about 20 million. But that is not a small number, 20 million. But the second wave, killed more than 50 million people. This is why, because people already they were celebrating mood. After the lockdown, it was uplifted. People went in a celebration mood. People moving from here and there, doing all sorts of merrymaking. And in that way, that's how now the infection, the people got the infection, and that's how many people died. And therefore, even recently, we have realized that, for example, when the bars and the restaurants were closed, when they were opened, what did the people do? They rushed to the bars, they rushed to the social places. That's where the people they meet in the evening, and in that way, that's how infection now can come in, and they can come in a different form.
Now, thank you, Bwana CEO. Now, let's talk about, now you have talked about fatigue,
Yes.
and actually people getting tired of the
Yes.
masks.
Yes.
And we've also seen people now are no longer, previously we had shops that had watering points at the door,
Yes,
and
yes.
people would do that.
Yes.
Now people have gotten tired of
Yes.
that. Now, what is the county doing
Yes.
to ensure that these people don't get tired and drop their guard?
Thank you, Bwana Karaja. That's why I say that's why we are going to the community. We want to know the level of transmission within the community, so that we see our measures really working. What is not really working? Are we using the right measures? Are we targeting the right people? Going by statistics, because statistics usually they don't lie. If you go to the statistic wise,
Yes.
you'll find that the people who are now affected mostly when it comes to the corona pandemic is the age group that is between 21 and that is the age group between 1 and 45. Those are the highest people that are getting this corona. We have about 639 people between 1 and 45. Between 16 and 30, we have 385, almost half of that age group. People who are above 60, we have only 75. People who are between 45 and 60, which is my cohort, we have about 328. What does it tell you? If you look about the age group,
Yes.
yeah, this is the age group that is very hard. This is the age group that is young, dynamic, who are looking for job opportunity. These are the people that are meeting in social places. These are people who are meeting in the public places. These are people who are traveling from here and there. And these are the people who are at risk of getting COVID-19. Now, when these people get COVID-19, what usually happen? their body immunity is very high. Their body immunity is not like the old generation, the people above 60. Now, when they come back home, they bring the COVID-19 to the old generation, the people whose immunity is down. And that's why when you go to the community, those people who are coming for testing, these are the cohort that is coming for testing. And you can see, and that is the majority in urban areas. If you come to Nakuru town, you sample any part of the Nakuru town, you'll find that the majority of the people who are in urban areas, moving here and there, are between that age group. Yes.
And actually, no, in like today's briefing by the county governor of Nakuru, he actually mentioned this and about the age between 31 and 45. It contributes to the big number of people, especially here in Nakuru County.
And those are also the people, may I also talk about it? Yes. Those are also the people who are not observing the COVID-19 regulations. I went to one of these big places, and I found 3 ladies eating from all the same plate. They were eating chips. And when I talked to them, I just greeted them, and I told them, "Are you aware about the COVID?" They said, "Have you ever seen somebody with COVID?" Yeah. They said they have never seen somebody with COVID, and they don't believe that there is COVID in Kenya. You see, these are the people, and those are the people who are affected most. And these are the people between the age of 20 to 45. These are the people who are in these urban areas. These are also the people we expect them in colleges. Yes.
Now, the age you've mentioned and the public perception. Because now that one has been a big thing.
Yes.
And even during our visits outside, you'll talk to people and they'll say, "Do you know someone who has had COVID?"
Yes.
I have not seen anybody with COVID.
Yes.
Do you know somebody or somebody? Such questions.
Yes.
And actually, they must be playing a part in the complacency that you can see.
Yes. Now we are getting what we call clustered type of infection. How are we getting this clustered? I want to give you a good example. There is one of the shops here in Nakuru town where we have these small stores. They sell curtains. The supplier of the curtains, the supplier got infected. The supplier infected the person who works in that store, who is employed to work in that store by a certain family. Then one of the family member, who is the parent of one of the family member from the same family, got infected. And what we got from that linkage is that the entire family of 5 got COVID, from a supplier to the workplace, from workplace to at household level. We have more than 5 families of the same sort. Yes. We have also another family whereby somebody is a preacher. The preacher gets COVID. Where is he getting COVID from? It's not a bar. It's not a supermarket. It's not a market. But from the congregation that this person is working from. Then the family also have the COVID. Even the neighbor who comes to visit this family, they have the COVID. You see, those are what we are calling clusters. If you mess the whole family. And that's why you usually say, protect yourself, protect your family, and protect your community. Yeah.
Let's talk about mistrust, which actually brings in actually the complacency that we're witnessing.
Yes.
There were people, and a few months ago we had the scandal that had hit KEMSA of the COVID million tests.
Yes, also is affecting.
And it has really played a big part because people are saying, this was something that was created to us. It actually doesn't exist.
In fact, let me tell you, when I was talking with these 3 ladies, do you know what they told me? The way you have talked about. They said this was a way of eating Kenya's money. Yeah, you are telling us there is COVID, but there is no COVID. You just wanted money from us. Yes. And you see, when people think that way, and also when the people see that our leaders that we believe in, they are not wearing masks, they are not keeping social distance, they are not obeying the public health guidelines, the COVID-19 protocols, what will they say? Yeah. We have also witnessed the political arena. People are not observing the public guidelines. And in that way, it is also playing a part. When you go to the matatu industry, just go to the matatu industry here in town, you will see that it is back to the normal. People are carrying to the capacity. Yes, I went to on Friday. I went to next to China's Gauss, where we have a stopover for public vehicles that are going to Western region. And what I got is I was surprised. People buying food, packed food, they enter to the vehicle, and they are going eating the food within the vehicle. The vehicle is full to the capacity. You see what is happening within that vehicle. Transmission. That is what we are talking about, transmission. And if people they don't take care, things can become worse.
Okay, so now, Bonasio, we have mentioned all these things.
Yes.
People have mistrust.
Yes.
The public perception is down.
And also denial.
And also denial.
Yes.
Now, what is the county government here in Nakuru doing
Yes.
in regards to this?
Okay, that's why we started what we call the target testing, so that what we are doing the target testing, we are doing target testing, and they also coming up with the measures that are targeted to those community. Like now, when you go to the statistics, you will find that 71% of the total population, or the 71% of the people who are infected with this COVID, they are male. While less than that percent are female. What does it tell you? It tells you that male gender is at higher risk. Now, we are now doing what we call targeted interventions. You are passing the information that you will target a certain group of people. And that's why we have already trained our community health volunteers. We have about 4,060 community health volunteers all over the county. We have trained them about the home-based care. We have trained them about contact tracing. We have trained them about risk communication, so that they can go house to house with the targeted messages for each and every member of the community. Yes.
Let's talk about our capacities.
Yes.
In our various facilities.
Yes.
That is Langa Langa, PGH here.
Yes.
We have annex
Yes.
on the highway,
Yes.
as well as the other sub-county
Yes.
facilities that
Yes.
had actually been set aside to help address this.
Yes.
Is the capacity able to match the numbers that we are having?
Okay. As for today, it's good that we see the numbers also as for today.
As for
today,
yes.
those who are admitted, the admissions are only 20.
Okay.
It's only 20 admission. And out of the 20 admission, 8 are admitted at PGH. And you know PGH, we have a capacity of about 24. Meaning, it's only a third. When you go to Naivasha, we have only 3 who are admitted. But the capacity in Naivasha is 11. When you go to Lagalaga, we have only 6 admitted. And the capacity in Lagalaga is 32. We have 3 in War Memorial. What I want to say is that the number is very low. Yeah, and we have the capacity. I can talk comfortably that recently we employed more than 500 health workers, and they were distributed equally in the entire county. Yeah, so that we can be able to improve our capacity. There's something that I also want to talk about. Out of all those people that we are talking about, we have what we call home-based care. And in home-based care, we have more than 538 people who have been on home-based care. Home-based care is that you are asthmatic, you are positive, we have isolated you at home. Our community health volunteers, health workers are coming to monitor you on a daily basis from the comfort of your bed. And therefore, out of those, 374 have already recovered, and they have gone back to their normal duty. It's only 164 that are on cure. Why have we done so? We have done that because doing home-based care is cheaper than hospital-based. When you do home-based care, it is 90% less than when you do hospital-based. So it is cheaper by 90% at household level than when it is in the hospital. And that's why if all these people are in the hospital, I can tell you that PGH could be full, Annex could be full, Ragaraga could be full, and also Bodeni could be full. But now we have only 20 admissions, but the others are within the community.
And in each of these home-based care facilities,
yes,
you have attached.
We have attached a public health officer or a community health extension workers who is a nurse or a public health officer. We have a health volunteer who have been trained by the community by us to take care of those people. And let me tell you, recovery rate is 100%. All those we have placed at home-based care, 100% of them they have recovered.
Okay. The show is Between the Lines. We are in studio today with the Chief Officer of Health Services here in Nakuru County, Dr. Samwel King'ori, who has been briefing us on the COVID-19 situation here in Nakuru County. We'll take a small breather. We'll be right back. Welcome back. The show is Between the Lines, and we are discussing matters of health here in Nakuru County. And in studio today we have the Chief Officer of Health Services here in Nakuru, Dr. Samwel King'ori, who has actually been briefing us on where we are as a county in regards to the COVID-19 and what the county is actually doing to help address the rising numbers. Keep sending in your comments, questions, using the hashtag Between the Lines on our different platforms of Facebook, Twitter, and YouTube. Bwana Daktari,
yes.
In our previous interview with the county government, the county actually mentioned that they had enough this personal protective equipment that would last the county up to October. Has the county made procurement for others, and where are we as a county in this fight?
Okay, thank you, Bwana Karaja.
Yes.
What I can say is that Nakuru County is well prepared. I want to say that since since February, that is on 29th January, when we heard about this issue of COVID in China, we sat down as a county, as a department, and we started the training of our health workers. And we called the national team to come and work with us. We come up with a plan. And this plan was supposed to, for mitigation of COVID-19 outbreak, because we were foreseeing a scenario whereby these cases can spread up to Kenya. And that's why we had to prepare a long time ago. What we did is that during that time, we came up with a work plan. And we did our plan, which was for about 6 months, because we were seeing that this COVID might go up to more than 6 months. This plan that we developed during that time, we have been keeping on updating that plan. And up to date, we are keep on updating that plan on a monthly basis. Why we are doing is that things keep on changing. This COVID-19 was a new disease. Nobody knew about the COVID. And therefore, the information that we are getting, we keep on changing. And therefore, we have to keep on updating our plan. So what we did is that we procured supplies in the month of June. Both non-farms and the pharmaceutical. And when we bought the supplies, we bought supplies worth 305 million. That was drugs. If you go to our hospitals, you'll find that all our hospitals, they have drugs. Like today I was in Mitimingi. I wanted to go and just to have a look at our facilities. And we found that the supplies that they have can last us for another 6 months. We have buffer stock within our county, various legion of stores. And the PPEs we have, they will take us up to the next month of November. Already last week, in the newspaper, started the newspaper, we advertised the supply, tender for supply of the PPEs, medical and non-farms. And let me tell you, by the end of this week, we shall be opening those tenders so that we also award other suppliers to supply more PPEs. I also want to say that during the today press briefing with His Excellency the Governor, he in fact he told the media people that we received more than 201 million for COVID-19, but because we used our own resources, we were able to tailor our budget, our last year budget, to be able to cope with the COVID-19. The 201 million we have not used. It is still in our special purpose account. And what we intend to do is that we are going to use 100 million to go and construct a hospital in Maimahio. Because in Maimahio, we are getting so many cases, not coming from the county, but these cases is as a result of having a testing center for truck drivers in Maimahio. When the truck drivers turn positive at Maimahio, they are reported as part of Nakuru County. And that is also what you should also note, that out of the 273 you are talking about, there are truck drivers who are there. The other issue is that Nakuru being a referral, it used to be a provincial hospital, and a referral for the region. The referrals still keep coming to Nakuru. You might find people coming all the way from Samburu, Laikipia, Nyandarua, Kericho, Barigo, and also Narok, being referred here through either PGH or other private hospitals, and they end up being tested in Nakuru, and those figures are added to our figures. Therefore, whatever you see the figures, they are not always the total figures from Nakuru County. And therefore, when it comes to the PPEs, we have adequate PPEs. And we usually use about 5,000 masks, surgical masks per day. You can imagine 5,000 masks per day. And one mask goes for between 45 shillings and 50 shillings. Yeah. Thank you.
Okay. Now let's talk about the reopening of schools.
Yes.
Last week the Cabinet Secretary for Education actually directed that today grade 4, Form 4 and Class 8 students were actually to report back to school. And there has been concerns even from the public and especially from parents with the question of, is it too early to send our children back to school, especially at a time when the numbers or the curve that the COVID-19 curve in our country has not been flattened?
Okay, that is a good worry, and the people, they have the right to be worried. Why? It's because they have not been told how prepared are we here, so that their children, when they are in this learning institution, they are safe. Because education is a national function, let me talk about what the county is doing on the same issue. You see, when people comes to, we shall get people from all over the country. That means we shall get people. We have national school like Naivasha Girls,
Yes.
Naivasha Boy, Nakuru Boys,
Yes.
Nakuru Girls.
Nakuru Girls.
We have so many. Even Kabarak High School, we have national schools here.
Yes.
We expect students as far as Madeira, as far as Mombasa, Turkana, even Kisumu. Name them.
Yes.
And what we as the county have done is that we have already done a zoning. We have zoned the county. And when you have zoned the county, we know how many schools there are in this zone. So that those schools are attached to a certain health facilities. And we have our public health officers who are managing those areas. What they are doing right now, we are doing the inspection of those schools, making sure that the COVID-19 protocols will be observed when the schools are open. We have already inspected most schools, even the TFETs, the universities. We have inspected even Kabaraki University, Egerton University. We are also going to inspect, and also the other learning institutions. And that is how we are being prepared to handle in case any problem. From Wednesday this week, we shall be meeting with the management of these institutions. That is the teachers. Like, for example, if it's a primary school, we are going to call all the teachers for training. We train them how to handle in case of a COVID suspect. How are they going to refer? Who is the contact, the focal person, so that they know how to manage it. And because one of the issues that they are supposed to do is that they are supposed to have thermal guns to take temperatures. When temperature is above what? Do they know how to take the temperatures? And if the temperature is above which level, what are they going to do? Sometimes somebody can take your temperature and the fact that your temperature is very high because you are learning, because you are doing other activities. What are you supposed to be done? You are supposed to be taken somewhere, relax, then a second temperature is taken. If the temperature is high, that is the time that they can call the medical personnel. But if the temperature goes down, it doesn't mean that you had COVID and it has gone. It has disappeared.
And
it means that was just a small issue. That is what we are going to take them through.
Mm-hmm.
Yes.
And speaking of now taking of temperatures and the thermal guns especially.
Yes.
Now, we actually did a survey here in our studio.
Yes.
There was one day that we walked through the street of Nakuru,
yes,
Kenyatta Avenue.
Yes.
And we asked the members of these different business places
yes,
to take our temperatures, one shop after the other,
Mm-hmm.
And the temperatures were different.
Yes.
This thermogun would show something different from this other thermogun, from this other thermogun. Now, think of that now in the context of a school. Don't you think that there's also that problem or that fear?
What I can say is that most of the thermoguns that are in the market, they are from different companies. Okay. There is what we call configuration, and when they are configured, there is they can differ, but they cannot differ. They can have a small range when it comes to the temperature. You might go to one thermogun, you find that your temperature is 36.4, and then you go to another one, is 36.3. Yeah, it has a range depending the manufacturer and the company and where it was manufactured, and therefore all of them they are correct. And what we usually do is that we usually give them the maximum temperature. And from that maximum is when we suspect somebody. Yeah.
Speaking of training, you have mentioned that the health department here in our county has been training and had actually trained the health workers in regards to the issue of COVID-19. Are there other sectors that you are targeting?
Yes, we have not been working alone. As a county, we have worked with everybody. We have trained the journalists. We have trained the police. We have trained the religious leaders. We have trained so many people, different cadre. And why we are doing that training is that we want everybody, we work together, we pull together in one direction. And therefore, the people that we have not trained is the teachers. Some teachers have been trained in various other forums, like leaders, like, for example, organized groups. But now we are going to train them as teachers in schools, so that they can also help us when it comes to the prevention of this COVID-19. Yes.
Okay. So let us talk about something that has been mentioned several times.
Yes.
And nobody wants it to happen. The second wave.
The second wave.
There has been concern that witnessing it from other, especially in European countries, that have seen a second wave hitting the countries.
Yes.
We don't want to compare ourselves with those countries. However, don't you think that these nations can also serve as a warning, even to us as a country?
I want to say that so far we don't have a second wave because of one thing. For us to say that we have the second wave, we have to collect the data for the next about 3 weeks. That is the time you know that we have another wave. But if data is to something to go by, like for example the way you are talking about the Nakuru, is because of intensity of targeted testing. If the whole country can go that direction, all the counties they do that way, that is the time you can know the true picture of Nakuru, of Kenya, whether we are going to have a second wave or not. But I want to say that even now, most developed countries are worried. They are worried because of one thing. They thought that Africa will be doomed with this issue.
We actually all thought that.
Yeah, even everybody was thinking about the same. But now, what they have seen is not the same, the way that is happening. Already, they are suffering the second wave. The first wave in Kenya, even other countries in Africa, they did not get it the way it was predicted. And therefore, what I can say is that this disease is a new disease, and what people they are talking about, they are talking in different manner. Like for example, someone was talking about the strain. That is the strain that came to Africa is not virulent like the strain that went to Europe. Yeah, we don't know whether it's true, but is it yesterday newspaper or on a Saturday newspaper? I got the newspaper that they were talking that the strain that came to Africa, it originated from Europe. And therefore, you see, when it comes to the issue of viruses are very unique in creatures. What they usually do what we call mutation. They can keep on changing the forms. They can change from one form to another one. And therefore, when they are changing those forms, they can even turn to be virulent at a certain level. Yes, because of the way they adapt to the situation. Yeah.
Or maybe our immunity systems are high.
We cannot say that our immunity is high because there are still other people who are dying.
Okay.
But what we can say is that the virus itself, it can change the form. Yes. And when it changes the form, it can be less harmful or it can be more harmful. Or it can be, we usually use the term virulent.
Okay. Now let's talk about what we're witnessing, especially among the political class.
Yes.
And you had alluded to this before we took the breather.
Yes.
Initially, at the beginning, when the COVID-19 had actually hit our country,
yes,
and the numbers were growing by the day, we witnessed even political leaders taking an effort,
yes,
doing even their own personal promotion messages, telling people that do this, avoid this, avoid this. 7 months later, all that has been thrown out,
yes,
and now we are back to roadside campaigns, public gatherings, and all of it, we have seen them. And actually, the president has actually come out and condemned such acts, telling the political class that it's not time to campaign. Let's avoid all these things, and such a view. Well, at the same time, they themselves do not even exercise the simple acts like wearing of the masks. Does this play a huge role in even the complacency among the public?
Yes, you know most of the public. I want to tell you that one thing with the Kenyans is that they believe more from the political than the professional.
True.
They listen more from the political. And therefore, when they see the politician doing the way they are doing, they start questioning. They start questioning because they believe in their politicians. And therefore, the way the politicians are doing, it will have a negative impact when it comes to the issue of COVID-19. Because in those rallies, in those meetings, whereby we are not keeping social distance, people are shouting, people are dancing, and you see the way the COVID-19 is transmitted. It is transmitted through the droplet, and therefore, if you are close proximity, less than 1 meter, you are likely to get the infection through the droplet, and therefore, that is one thing that we should request our politician. Let us calm down. Let us educate our people. Even if you have to have the meetings, tell your people, when you are coming to the meetings, wear mask, then have social distance, so that we can slow down this spread of COVID-19.
That's social distance of like 500 people. That is
yeah. Already we have been given guidance by His Excellency the President.
Yes.
For example, in a burial or in a wedding, it is supposed to be 200 people, even in church. But when you go to the public places, they come in thousands. Yes, and they cannot keep the social distance.
Okay, so one of the things that actually the Ministry of Health has actually been insisting, especially, has been on the adherence of the guidelines set. Mm-hmm. And in the briefing today by the county governor, Governor Lee,
yes,
he actually mentioned that the opening of social places, including markets, churches, and bars, actually active infection avenues that require close monitoring to ensure compliance to the set guidelines.
Yes.
What is the county, especially the Ministry of Health, planning to do, especially now that bars are now open?
Yes.
They have been allowed to run up to 10 o'clock. Yeah. Hotels are also open. Churches are back to.
Yes. I want to say that as a county government, the COVID-19 regulation still stands. The regulation still stands. And therefore, I want to tell the public, the business people, those people who organize social events, that the law is still there, and the guidance has to be followed. One thing that we are going to do as a county, anybody that will float this regulation, will not adhere to this regulation, we are going to take stand of action. If, for example, it's a bar that does not observe the COVID-19 regulation, we are going to withdraw the license. If it's a hotel, we are going to close it down. Yeah, we are not going to just to relax and wait our people to die with the COVID-19 because of laxity of some people. Yeah. Okay. So I want to tell the public that the COVID-19 regulation, that is public health guidelines and the regulations, still stands. And as we open the schools, those COVID regulations have to be adhered to. Yes.
Okay, the show is Between the Lines. I'm your host, Karanja Jackson. We are discussing matters of health. And in studio today, we have the Chief Officer Health in Nakuru County, Dr. Samwel King'ori, who has actually been briefing us on where we are as a county in terms of fighting of the COVID-19. Bonasio, let me. There's a question that has been sent to us through by Yasmin Charles.
Yes.
And she asks, what are you doing to ensure our health sectors are well prepared to handle COVID-19 cases, especially at this time that the numbers here in Nakuru are registering high?
Okay, that's a good question coming from our viewers. I want to say that as a county, we have been able to do what we call capacity building of our staff. We have been able to train more than 1,500 staff. That is doctors, nurses, clinical officers, people from the laboratory, and others. Meaning that we are fully prepared for that. Yes. We have also trained our community health volunteers, our public health officers, on preventive measures on the same. And what we have already planned for is to train our staff on infection prevention and control in our hospitals. Because within the hospitals, we can still also get this COVID-19. Because that is where we are handling the sick people. And therefore, we are training them on infection prevention and control. Yes.
Another comment is that while we congratulate the county government of Nakuru, where unlike other counties, we've seen health officers down in their tools, here in Nakuru it has been different. What about the home-based care workers? What are you doing to ensure that these people are adequately protected over the others?
Yes, already what we have done with the community health volunteers, we have given them uniform. They have the uniform, they have a jacket, and that jacket is for identification when they are on duty. We have also given them a mask, which are a reusable mask, so that after the end of the day, they can go and wash and they use the following day. We have also trained them about the prevention of COVID-19 and also risk communication, so that when they go to the households, therefore, they are able to observe the guidelines accordingly, so that they should protect themselves, protect their family, and also the community they are coming from. Yes.
I am a parent. This is another comment. I am a parent, and my child will be joining school today, like all the others. How will the county government ensure that my child keeps the mask on during the entire time?
Okay, thank you. That is a good question from a parent. I want to say that it's not the county government that will make sure that the mask is still on. That's why we are saying that we are prepared to train the teachers so that they can make sure the masks are on throughout the day. Because most of the students or pupils, they will be they are day scorers, and the others are boarders. And therefore, if they are boarders, it is the work of the teachers who are in those institutions to ensure that these students, they have the mask on throughout. For those parents, for those students who are the scorers, it is the responsibility of the parent and also the teachers to ensure that, one, the child has the mask. Because the first thing is, do they have the mask? Do they have the right mask? And then the question of how to wear the mask come later. And therefore, it's the work of the parent and also the teachers to ensure those students, they give the mask. But we, as the department, we are going to educate the teachers and sensitize the teachers.
I want to pick something that you've mentioned.
Yes.
They are wearing the right masks.
Yes, the right mask.
Do we have masks that are good or better than others?
Yes.
Or will all children be required to wear the surgical mask?
Okay. When it comes to the student or the pupils at household level, we don't recommend them the surgical mask. The surgical masks are for doctors and health workers. But when it comes to the schools, they can wear what we call reusable mask, so that these masks can be used, they can be washed and be reused. Yes, because of the issue, even also the profession. Where do they get them? Where do they get them? And also the issue of hygiene. Yes.
Another question from Mildred Mwai. What measures has the county taken in schools that were previously used as quarantine and isolation centers?
Okay, that is also another good question. I can say that comfortably what we have been able to do is that we have already fumigated those schools. One of the schools that was used as a quarantine center is Naivasha Girls High School. We are very happy that the principal and the board of management, they allowed us to use the school. And immediately when we closed down the quarantine, we fumigated the school. And therefore the school is safe for people to use. The other institution that we used as a quarantine is Kitty, just here in Nakuru town. That is Kenya Industrial Training Institute. And already we have done what we call fumigation. And now the school, the institution is ready for running. Yeah.
Okay, keep sending in your comments, questions. We will sample them as we continue. The show is Between the Lines. We are discussing matters health here in our county, in our county of Nakuru County, with the Chief Officer Health Services, Dr. Samwel King'ori. Bona Daktari, in the previous interview that we had with the county government, actually,
yes.
The cabinet, the CEC, mentioned and actually shared with us that there was progress in the building of things like the 4-story ultra-modern outpatient facility at PGH. There was the Gilgil maternity wing, the Olenguruoni sub-county hospital, and also the upgrading of the Naivasha outpatient wing. How far are we?
Okay. Yes, I want to talk about the health infrastructure in Nakuru County.
Yes.
Most of the health infrastructure in Nakuru County, they were started as barracks, military barracks. For example, in Naivasha, it was a military barracks in 1901. When you come to Gilgil, it was also a military barrack. When you come to PGH, the same. What I want to say is that for a long time, our health infrastructure have been neglected. At this time, we have been able to put more money in health infrastructure. For example, we have already advertised for upgrading of Maimahio Health Center to a level 4 hospital. at a cost of 140 million. We have upgraded Naivasha through Kengen at a cost of 331 million. For Naivasha, it will be ready by next year, May, because already we are doing the roofing. For Mai Mahiu, within 1 year, it will be ready. Here in Gilgil, we have also constructed another building at a cost of 40 million. The building is already 97% complete. Inside is already complete. What we are waiting is the septic tank and also the drainage, plus the water. And we operationalize the building. Here in PGH, we have constructed a building worth 5 million. It will be the biggest complex within Nakuru County. At this complex, it will, on a daily basis, it will be able to take care of more than 2,000 people who will be visiting for services in our hospital. Currently, we usually get more than 1,500 per day. And when you go to our outpatient, you get that it is congested and there is confusion. Now, what we have done in PGH is a complex 3-story building, and it has what we call an emergency or casualty department, fully functional. It will be fully functional. Therefore, when there is any accident or there is any emergency, the emergency will not, the people who are seeking services at our OPD, they will never see the casualty. Mm-hmm. And therefore, that is a plus to us. Mm-hmm. The other thing that we are also doing is that our PGH is already above 90% complete. By the end of this year, we are going to operationalize it. Mm-hmm. And already we have started procurement of equipment, mm-hmm. so that immediately we can operationalize the construction. Mm-hmm. The other one is Joro. Mm-hmm. Joro, we have already advertised a tender of about 140 million. We are going to upgrade Joro to a level 4 hospital, whereby we have theater, we have X-ray, we have inpatient, and other services, more than 50 services in Joro. What we want Joro is that all those people who have been referred to PGH will not be referred again. The referral that we will be expecting from Joro is only specialized referrals. Mm-hmm. In Erbagon, we have also another construction worth 40 million. It is already 85% complete, and I expect within the next 2 months it will be complete. In Moro, we are constructing an outpatient complex worth 100 million. Already the contractor is on site, mm-hmm. and the work is ongoing. Mm-hmm. In Kerigate, in Oregroni, we are also doing another complex. Already the contractor on site, mm-hmm. and is doing the first floor. Mm-hmm. We are also going to construct another one in Sirikwa. That Sirikwa is in Kuresoi North. We upgrade the Sirikwa Health Center to a level 4 hospital. We are also going to do Subukia, so that we can upgrade the facility. Mm-hmm. In short, what we are doing, we want to modernize our facilities, modernize our equipment, modernize our service delivery, so that our people in Nakuru County, they can get the right services. Mm-hmm. We don't want to be referring people to Nairobi. Why do we refer people to Nairobi? It's because we don't have those services. And now this is the right time we put those services here. Like for example, in PGH, we also have another complex that is coming up. It's almost 97% complete. The cancer bunker. This bunker, we are going to get equipment from the national government. It has been constructed through the collaboration of the national government and the county government. This will be a radiotherapy center, whereby if you have cancer, you don't need to go to Nairobi. You'll be treated here and go home. Instead of booking rooms in Nairobi to wait for 6 months to be served, you'll now be walking to PGH, get your services, go home. And that way, the treatment of cancer will go down. What we are also talking about is that we have a conversation. We are asking ourselves, why do people go to India? Why do people go to India? How much money is used by the Kenyans to go to India? Why don't we bring India here in Kenya? And in that particular, we bring it in Nakuru. It's cheaper to bring India in Nakuru instead of going to India. And that's what we are doing. And that's why we started with the infrastructure, so that even human resource, we are also going to improve. Already we are employing the cancer and specialist, so that they can work in our facility. Mm-hmm. Yes.
Thank you very much. Now, Final comments. What
Yes.
would you want to tell people who are listening or watching us?
I want to tell the listeners today is that COVID is real. If you have not gotten one, if your family member has not be affected, it doesn't mean that we don't have COVID. COVID is there, and some people, about 35 people, as we are, 39 people, as we are seated here today, they have died through COVID. And therefore, if yours have not died, please protect your loved one. Protect yourself and protect the community that you are coming from, because COVID is real.
Thank you very much, Bwana Daktari, and congratulations on the impeccable work that you and the Waziri are doing in the Ministry of Health. The people who have been watching have been saying that I need to pass this message that the health department has been outstanding, especially in the handling of the COVID-19 and the health situation in our county.
Thank you.
Salimia sana Waziri.
Yeah,
Tell
asante
him all the best in all that you guys are doing.
Yeah, okay. I want to say that it is our joy to serve Nakuru County better.
Okay.
Yeah, thank you.
Thank you very much. The show has been Between the Lines. I have been your host, Karanja Jackson. We've been discussing matters of health here in Nakuru County. For all those that took their time to watch and comment, we want to say thank you. Until next time, stay safe.
In the last 2 weeks, Nakuru County has recorded 273 COVID-19 cases. This is a high number considering the daily tallies for other counties. The situation has caused great concern among residents and investors in the region. To address the situation, the county wishes to inform the public as follows. 1. The enhanced testing on target population has been extended to 7 sub-counties out of our 11 sub-counties. Initially, we used to test about 1,000 people per week, but we have doubled the number to a weekly testing target of 2,500. Yesterday, Nakuru contributed 10.5% of the total samples taken for testing in the whole country, which was 4,287. The targeted testing is a recommended WHO approach towards prevention and the spread of the disease. This is because it helps us to know the magnitude of the disease and the appropriate measures to employ to curb the spread. With increased targeted testing on asymptomatic population, we are bound to get more cases. We consider the emerging numbers to be a fair representation of the community infection status. Allow me here to just clarify that whereas our population is approximately 4.8%, we would therefore assume that if everybody was to take equal number of samples for testing, that Nakuru would contribute its usual 4.8. But because we have changed our approach in recommendation of the WHO approach of mass testing, Nakuru has ended up testing more than double its share, which means the more we test, the more we are likely to get positives. And therefore, maybe the dilemma is, if you test more, you get to know your true status, and therefore you appear as if your situation is bad. Whereas in reality, there are many other situations or many other counties where the testing is far below even their population quota. And I think this is really one perception issue that we really need to deal with, that Nakuru is doing the right thing, and we wish to continue with this targeted testing so that we can inform our public health approach and also inform the public on areas that they need to do better. Secondly, we have also noted laxity by members of the public on preventive measures. We wish to note with great concern that the back to normal attitude adopted by a large section of the public is a major hindrance to our efforts to combat the pandemic. Low adherence to public health guidelines has contributed to increased infections. And I think a random check on our markets, on our public transport system, on visitors, and all the people in social places indicates that there has been a near back to normal situation that is a major challenge to our overall attempts to improve our response to the pandemic. Thirdly, the opening up of social places, including markets, churches, and bars. These three critical areas are active infection avenues that require close monitoring to ensure compliance with set guidelines. We wish to reiterate that the opening of these places was subject to strict guidelines and compliance with public health regulations. Consequently, we shall not hesitate to revoke licenses if we find a negligence to lay down protocols by these businesses. I think we want to clarify here that be they churches or markets, and especially bars, and allow me to say for bars, because people go there to indulge, as they indulge, they throw away caution, and in the process become a danger not just to themselves, but also when they go back home, they can be a line of infection arising from that back to normal attitude, especially in our alcohol selling places. Fourth is that in view of the prevailing circumstances and the opening of schools and other tertiary institutions, the public health team will be making deliberate recommendations upon consultations with stakeholders this Wednesday. That is October 14th, 2020. This will be especially for the worst hit areas of Nakuru East and Nakuru West. And I think here what you're trying to say is that we will call our stakeholders in education, in the hospitality sector, and see whether out of the recommendations by the public health nationally, we need to add more restrictions or what we can do. And I think this would best be done in a broader consultative environment, such as the one we have called for Wednesday this week. Nakuru COVID-19 data for 12th of October is as follows: that a total of 20,594 have been tested across the county. The confirmed cases are at 1,500. Most of the new positive cases are among the ages of 31 to 45. 557 patients have recovered, and 199 in our health facilities, while 358 have recovered from the home-based care. And while on this, allow me to say that we really wish to inform the public of the existence of an elaborate home-based care approach, and therefore even for those who are symptomatic, driven by the need to protect themselves and those around them at work and home, there is a very high need to ensure that they are properly educated and well informed on how to adopt this home-based care. And for this reason, when you are tested and found to be positive and you are symptomatic, you need not hide, but instead ensure that our public health team is aware so that we can give you the appropriate information necessary for managing the process. Then lastly, we have 20 patients who are admitted in our isolation facilities. 14 are on supplementary oxygen, and 8 are currently at our PGH COVID-19 isolation center. And 3 are in Naivasha, while 6 are in Langalanga, and 3 at War Memorial Hospital. That Kenya Railways has in the past few days been demolishing property on its land along Geoffrey Kamau Way in Nakuru town. We wish to state that this exercise is by the Kenya Railway and other agencies, and that the county government of Nakuru is not part of this exercise. And just for information, is that this land is owned by Kenya Railways, and they got into lease arrangements with private citizens, and as a result of those lease arrangements, members of the public and investors for that matter went forward and started investing in various businesses as are to be found there. We note that Kenya Railways reclaiming the land in preparation for the rehabilitation of the Nakuru Kisumu line and construction of the Rironi-Mau Summit Highway is in order, because this is really their land. However, we wish to note with concern that the manner in which the demolition was done and the resultant loss of property worth millions of shillings is inconsistent with the need to protect private property and also to encourage investors to continue working in a climate that has predictability. In such reclamation, we would expect that adequate notice would be given to traders who have invested heavily, and unfortunately, even at the time of demolitions, some of those properties were still under construction. And also, a county being a key stakeholder in this conversation, that no notice was served on us on this particular matter, and therefore we wish to pass our sympathy to the investors who've lost millions and millions of shillings, to employees who will have nowhere to report to, and indeed to request and also seek redress on this matter, because some of these business people will probably not be able to stand again after the demolition that we have seen. That yes, we need to give way for development to happen, be it railways and all those other things, but as we do so, let us also remember that even the small investor who runs a petrol station, who runs a car wash, and all those other businesses are equally important investors who must be treated with caution, and they must also be given an environment of predictability. When you're given a lease of 25 years and abruptly you're told to leave within hours, that leaves you with very little options, and some of them have actually bank loans to service that will now find themselves in a very difficult situation. Thank you. Any questions? We also have information here on some of our sub-county, the number of people who've tested, the cases. In other words, the disease burden per sub-county. I don't need to read it. I think we shall share that with you for any questions that you may have. And also our positivity rates, which is also very important compared to the national positivity rates. And I want to confirm that Nakuru's positivity rate is much lower than the national positivity rate. But I think those are details you get from this communication.